Welcome back to our channel. Today we will discuss the most important 12 vitamins to improve vaginal health. First up, we have vitamin A true superhero for maintaining healthy mucous membranes, including the vaginal area. These membranes act as a protective barrier against unwanted invaders, keeping harmful bacteria and viruses at bay. Vitamin A is also essential for cell growth and repair, preventing infections and ensuring smooth functioning of vaginal tissues. Load up on sweet potatoes, carrots, and dark leafy greens. They're all excellent sources of vitamin A. Incorporating these foods into your diet can significantly boost your overall health, enhancing your body's natural defenses and promoting a well-balanced, vibrant lifestyle. So, make sure to include these nutrient-rich foods in your daily meals. Next, we have vitamin C, a powerful antioxidant that boosts your immune system and supports vaginal health. Vitamin C aids in collagen production, maintaining the integrity and elasticity of your tissues. Citrus fruits like oranges, grapefruits, and lemons are bursting with vitamin C. Strawberries and bell peppers are great additions to your plate as well. Now let's talk about vitamin D, the sunshine vitamin, crucial for immune function and hormone regulation. Vitamin D helps your body absorb calcium, maintaining a healthy pH balance in the vagina. It also plays a role in maintaining a healthy vaginal microbiome. Ensure you get enough sunlight and consider foods like fatty fish and fortified dairy products. Vitamin E, the antioxidant for elasticity. Vitamin E helps maintain the elasticity of vaginal tissues and reduces symptoms of dryness. Nuts and seeds like almonds, sunflower seeds, and hazelnuts are fantastic sources. Leafy green vegetables are also packed with nutrients, including vitamin E. Keep your tissues elastic and comfortable with adequate vitamin E levels. Vitamin B6, the hormone balancer. Vitamin B6 supports hormonal balance, alleviating PMS symptoms and regulating menstrual cycles. It also aids in neurotransmitter function, impacting mood and overall well-being. Bananas, poultry, and chickpeas are great sources of vitamin B6. Incorporate these foods into your diet for better hormonal health. 6. Vitamin B12, the energy booster. Vitamin B12 is crucial for red blood cell production and nerve function, supporting vaginal health. It ensures tissues receive adequate oxygen, essential for cell function and repair. Vitamin B12 also helps regulate menstrual cycles. Include sources like meat, dairy, and fortified cereals in your diet. Now let's talk about folate, essential for cell division and DNA synthesis. Folate helps manage hormonal levels and reduces the risk of birth defects. Leafy green vegetables, legumes, and fortified cereals are excellent sources. Incorporate these foods into your diet to support vaginal health. Moving on to vitamin K, crucial for blood clotting and tissue repair. Vitamin K promotes proper tissue healing, especially after childbirth or trauma. It also helps regulate menstrual cycles. Ensure you get enough vitamin K from leafy greens and other sources. Omega-3 fatty acids reduce inflammation and support vaginal health. They maintain the health of the vaginal lining and balance hormone levels. Include sources like fatty fish, flax seeds, and walnuts in your diet. Omega-3s help soothe and protect the vaginal lining. Probiotics are essential for maintaining a healthy vaginal microbiome. They balance good and bad bacteria, preventing infections. Yogurt with live cultures, kefir, and fermented foods like sauerkraut and kimchi are great sources. Keep your vaginal ecosystem in harmony with probiotics. Zinc supports immune function and wound healing, maintaining a healthy vaginal environment. It helps repair damaged tissues and regulate menstrual cycles. Include sources like meat, shellfish, and legumes in your diet. Ensure you get enough zinc to support vaginal health. Magnesium regulates muscle and nerve function, easing menstrual cramps and discomfort. It also plays a role in hormonal balance. Nuts, seeds, leafy greens, and dark chocolate are great sources. Enjoy dark chocolate for a magnesium boost and better vaginal health. Incorporating these vitamins and nutrients into your diet supports optimal vaginal health. A balanced diet rich in these nutrients can make a significant difference in your overall well-being and energy levels. Remember, small changes in your daily meals can lead to big health benefits over time. Thank you for watching. Please give this video a thumbs up and subscribe for more health tips and wellness advice. Consult with a healthcare provider for personalized advice tailored to your needs. Take care and see you in the next video.
Hello and welcome to our channel today. We're going to clarify an important distinction between two types of infections that can affect your health. Sexually transmitted infections, or STIs, and urinary tract infections, or UTIs. Understanding these differences is crucial for proper diagnosis, treatment, and prevention. Let's dive in. Don't forget to subscribe, share this video, and drop a comment below. What are STIs and UTIs? Sexually transmitted infections, or STIs, are infections that are primarily spread through sexual contact. They can be caused by various pathogens, including bacteria, viruses, and parasites. Common STIs include chlamydia, gonorrhea, syphilis, herpes, human papillomavirus, or HPV, and HIV. Urinary tract infections, or UTIs, are infections that occur in any part of the urinary system, including the kidneys, ureters, bladder, and urethra. They are typically caused by bacteria, with Escherichia coli or E. coli being the most common culprit. UTIs are not necessarily transmitted through sexual activity, but can be influenced by factors related to sexual activity. Symptoms. STI symptoms. The symptoms of STIs can vary widely depending on the infection, but may include pain or burning during urination. unusual discharge from the genitals, itching or irritation in the genital area, pain during intercourse, sores or warts on or around the genitals, and flu-like symptoms such as fever and body aches in some cases. UTI symptoms. UTIs typically present with symptoms such as a frequent, urgent need to urinate, a burning sensation during urination, cloudy, dark, or strong-smelling urine, pain or pressure in the lower abdomen or pelvis, and a feeling of incomplete bladder emptying. In severe cases, there may be fever or back pain, which might indicate a kidney infection. Causes and risk factors. STIs. Transmission of STIs occurs through unprotected sexual contact, including vaginal, anal, or oral sex. Risk factors include having multiple sexual partners, engaging in unprotected sex, having a history of STIs, and not using barrier protection like condoms. UTIs are commonly caused by bacteria entering the urinary tract. Contributing factors include poor hygiene, urinary retention, certain types of birth control like diaphragms, and anatomical factors. Risk factors for UTIs include female anatomy, sexual activity, pregnancy, and conditions like diabetes or a weakened immune system. Diagnosis. STIs, diagnosis often involves a physical examination. Laboratory tests such as urine tests, blood tests, or swabs of the affected area. Some STIs require specific tests to identify the pathogen, such as nucleic acid amplification tests, or NAATs for chlamydia and gonorrhea. UTIs. Diagnosis typically involves a urinalysis to detect the presence of bacteria, white blood cells, or blood in the urine. A urine culture may be performed to identify the specific bacteria causing the infection and determine the most effective antibiotics. Treatment. STIs. Treatment varies depending on the specific STI and may include antibiotics for bacterial STIs, antiviral medications for viral STIs, or other targeted therapies. It's important for sexual partners to be treated simultaneously to prevent reinfection and further spread. UTIs. UTIs are generally treated with antibiotics prescribed by a healthcare provider. The choice of antibiotic depends on the bacteria identified. Increasing fluid intake and using pain relief measures may also help alleviate symptoms. Prevention. STIs. Use barrier methods such as condoms or dental dams during sexual activity. Get regular STI screenings, especially if you have multiple partners. Vaccinations are available for certain STIs such as HPV. UTIs. Maintain good personal hygiene, including wiping from front to back. Stay well hydrated and urinate regularly to flush out bacteria. After sexual activity, urinate to help clear bacteria from the urethra. Conclusion. Understanding the differences between STIs and UTIs is crucial for effective management and prevention. While STIs are primarily spread through sexual contact and can affect various parts of the genital tract, UTIs are infections of the urinary system that can occur independently of sexual activity. If you experience symptoms of either, consult with a healthcare provider for accurate diagnosis and appropriate treatment. If you found this information helpful, please subscribe, share, and drop a comment below. Feel free to leave any questions or comments below. Thanks for watching and take care of your health.
STIs and UTIs are different types of infections. They affect different parts of the body. It's important to know the difference. This helps you get the right treatment. What is an STI? STI stands for sexually transmitted infection. STIs spread through sexual contact. Examples include chlamydia, gonorrhea, and HIV. What is a UTI? UTI stands for urinary tract infection. UTIs happen when bacteria enter the urinary system. This system includes the bladder and urethra. Understanding the difference is crucial. It helps you take care of your health. If you have any concerns, talk to your doctor. Recognizing the signs, symptoms of STIs and UTIs. STIs and UTIs have distinct symptoms. Recognizing them is vital for early treatment. STI symptoms vary depending on the infection. Common signs include unusual discharge from the genitals, pain during sex, sores or bumps around the genitals, painful urination. UTIs typically cause frequent urge to urinate, pain or burning during urination, cloudy or strong-smelling urine, pelvic pain in some cases. It's important to remember that some STIs may be asymptomatic. This means you can have an STI without showing any symptoms. Regular testing is crucial, especially if you're sexually active. Causes and risk factors, how infections develop. Understanding the causes and risk factors of STIs and UTIs is essential for prevention. STIs are primarily caused by bacteria, viruses, or parasites. They spread through sexual contact, including vaginal, anal, and oral sex. Risk factors include unprotected sex, multiple sexual partners, history of STIs. UTIs occur when bacteria, usually from the rectum, enter the urethra. This leads to infection in the urinary tract. Risk factors for UTIs include female anatomy, shorter urethra, sexual activity, certain medical conditions, diabetes, use of catheters. Knowing these factors helps you make informed decisions about your health and take necessary precautions. Section 4, Diagnosis, identifying STIs and UTIs. Diagnosing STIs and UTIs involves different tests. These tests help determine the type of infection and guide treatment. For STIs, diagnosis typically involves physical examination, urine tests, blood tests, and swab tests of affected areas. UTI diagnosis usually involves urine analysis and urine culture to identify the bacteria. Early diagnosis is crucial for both STIs and UTIs. It prevents complications and allows for prompt treatment. Section 5. Treatment options, addressing the infections. Treatment for STIs and UTIs depends on the type and severity of the infection. Bacterial STIs like chlamydia and gonorrhea are typically treated with antibiotics. Viral STIs, like herpes and HIV, require antiviral medications to manage the infection. UTIs are usually treated with antibiotics to kill the bacteria causing the infection. Drinking plenty of water is also recommended to flush out the bacteria. It's essential to complete the full course of medication as prescribed by your doctor, even if symptoms improve. Section 6. Prevention is key, protecting your health. Preventing STs and UTIs involves adopting healthy habits and taking necessary precautions. STI prevention tips include practicing safe sex by using condoms consistently, getting tested regularly for STIs, especially if you have multiple partners, talking openly with your partner or partners about sexual health, limiting your number of sexual partners, and getting vaccinated for HPV, which can protect against certain types of cancer. UTI prevention tips include practicing good hygiene, especially after using the restroom, wiping from front to back after urination to prevent bacteria spread, urinating after sexual activity to flush out bacteria, drinking plenty of water to stay hydrated, and avoiding holding your urine for prolonged periods. Remember, prevention is always better than cure. By following these tips, you can significantly reduce your risk of STIs and UTIs.
Have you ever treated a vaginal infection only to find it stubbornly returning? You're not alone. I'm going to explain 3 major reasons why your vaginal infections might keep coming back. Understanding these reasons is the first step to breaking free from the cycle. Now let's get right to it and uncover the reasons behind those pesky recurring infections. Using the wrong medication. The first reason why those vaginal infections keep making an unwelcome reappearance is that you might be using the wrong medication. It's a common mistake that many people make. It's tempting to self-diagnose and grab an over-the-counter remedy, hoping for a quick fix. After all, who wants to deal with the hassle of a doctor's appointment? But not all vaginal infections are created equal, and they certainly don't all respond to the same treatment. Each type of infection requires a specific approach. Many people assume that all vaginal infections are yeast infections, but bacterial vaginosis, trichomoniasis, and other infections can also cause similar symptoms. These conditions can be easily confused. Using the wrong type of antibiotic can make your symptoms seem to improve temporarily, but the infection might return because the medication wasn't the right fit. This can lead to a frustrating cycle of recurring symptoms. So, what should you do? Visit a healthcare provider to get the right diagnosis and treatment. A professional can determine the exact cause of your symptoms and prescribe the appropriate medication. This ensures that you are treating the infection effectively and reduces the chances of it coming back. Remember, proper diagnosis is key to effective treatment. Not completing your treatment. The second reason why those pesky vaginal infections might be staging a comeback is not completing your prescribed treatment. This is a common mistake many people make. We start feeling better, the symptoms seem to have vanished, and we think we've kicked the infection to the curb. It's easy to assume that once the discomfort is gone, the problem is solved. But even if your symptoms have taken a hike, it doesn't necessarily mean the infection has left for good. The underlying issue might still be present, just not as noticeable. When your doctor prescribes a treatment, it's usually for a specific duration to ensure the medication has enough time to do its job effectively. This duration is carefully calculated based on the type of infection and the medication used. If you stop the medication too early, some bacteria might still be lurking, leading to a resurgence of your infection. These remaining bacteria can become more resistant, making the infection harder to treat in the future. Completing your full course of medication is crucial to ensure all the bacteria or yeast is eradicated. This not only helps in completely curing the infection, but also prevents it from coming back stronger and more resistant. Always follow your healthcare provider's instructions and finish the entire course of treatment, even if you feel better before it's done. This is the best way to ensure your health and prevent future complications. Reinfection. The third reason those unwelcome vaginal infections might be making a return appearance is reinfection. This can be particularly frustrating and disheartening for many women who thought they had successfully treated the issue. Many vaginal infections, like certain types of yeast infections and bacterial vaginosis, can be sexually transmitted. This means that even if you have taken all the necessary steps to treat the infection, it can still come back if your partner is also infected and hasn't been treated. If you have unprotected sex with a partner who also had the infection but hasn't been treated, you could get reinfected. This cycle of reinfection can be quite challenging to break, especially if both partners are not on the same page regarding treatment. Even if your medication cleared the infection in your body, it doesn't mean you're immune to it. The same infection can reoccur if the source of the infection, which could be your partner, is not addressed simultaneously. Most healthcare providers recommend that both partners get treated simultaneously for sexually transmitted infections to prevent this issue. This approach ensures that both individuals are free from the infection, reducing the chances of passing it back and forth. Communication and joint responsibility are key to preventing reinfection. Open discussions about sexual health and mutual agreement on treatment plans can significantly help in managing and preventing these recurring infections. That's it for today's video on recurring vaginal infections. I hope you found this information helpful. If you want to see more videos like this, click that subscribe button below and join our awesome YouTube family. Don't forget to give this video a thumbs up if you liked it and leave any questions or comments you might have in the comment section below. Bye!
Hello and welcome to our channel. Today, we're going to talk about a topic that's crucial for understanding your vaginal health, vaginal discharge. We'll cover what's considered normal, what might be a sign of something more serious, and when you should seek medical advice. Let's dive in. Vaginal discharge is a natural part of a woman's reproductive system. It's produced by glands in the cervix and vagina and serves several important functions, including keeping the vagina clean, moist, and protected from infections. However, changes in discharge can sometimes be a sign of a health issue. Let's talk about the nature and color of normal discharge. Clear or white and sticky. This type of discharge is typically seen around ovulation and is usually normal. It can be thick or thin and may appear somewhat sticky. It helps with sperm transport and fertilization. Milky white. This is common at the beginning or end of your menstrual cycle and is usually due to changes in estrogen levels. It can be slightly thick but should not have a strong odor. Thin and watery. This type is often seen in the days leading up to your period. It's usually clear or slightly cloudy and should not cause irritation or discomfort. Now, let's look at some types of discharge that might indicate an issue. Yellow or green discharge. This could signal an infection, especially if it's accompanied by a strong odor, itching, or redness. It's often associated with bacterial vaginosis or sexually transmitted infections. Gray or thin discharge. A grayish, thin discharge with a fishy odor can be a sign of bacterial vaginosis. It's important to seek medical advice if you notice these symptoms. Brown or blood-tinged discharge. This can be normal as your period is ending, but if it occurs outside of your menstrual cycle, it could be a sign of irregular bleeding or other conditions, such as polyps or fibroids. Persistent brown discharge should be evaluated by a healthcare provider. Itchy, lumpy, or cottage cheese-like discharge. This type of discharge, which can be white and clumpy, may indicate a yeast infection. It is usually accompanied by itching and discomfort. So when should you seek medical advice? It's important to consult your healthcare provider if you experience persistent discharge, if you notice any of the above abnormal discharges for more than a few days, or if they worsen. Let us now talk about the accompanying symptoms of abnormal vaginal discharge. Accompanying symptoms. Symptoms like 1. Itching, burning, unusual odor, or pain during intercourse or urination. 2. Significant changes. Any new or sudden changes in the color, consistency, or smell of your discharge. When discussing your discharge with your healthcare provider, be prepared to share. Duration and frequency. How long you've noticed the change and how often it occurs. Additional symptoms, any other symptoms you're experiencing. Menstrual cycle information, any recent changes in your cycle or hormonal changes. Before we wrap up, let's address a few common misconceptions about vaginal discharge. There's often a lot of confusion and stigma surrounding this topic, so it's important to clarify. Misconception: discharge is always a sign of infection. Many people worry that any change in discharge means something is wrong. However, many variations in discharge are completely normal and related to your menstrual cycle or hormonal changes. Misconception: you should avoid talking about discharge. It's crucial to feel comfortable discussing vaginal health with your healthcare provider. They are there to help and provide support without judgment. Misconception: over-the-counter products can fix everything. While some over-the-counter products can help with minor issues, it's essential to get a proper diagnosis and treatment plan from a healthcare provider if you experience persistent or severe symptoms. To maintain overall vaginal health and reduce the risk of abnormal discharge, consider these tips. Maintain good hygiene. Use mild, unscented soap and avoid douching, which can disrupt the natural balance of bacteria in your vagina. Wear breathable fabrics. Opt for cotton underwear and avoid tight-fitting clothes to reduce moisture and prevent irritation. Stay hydrated. Drink plenty of water to help your body stay hydrated and maintain healthy mucous membranes. Healthy lifestyle. A balanced diet, regular exercise, and avoiding smoking can support overall reproductive health. If you're looking for more information or support, there are several resources available. Online health portals websites like the Mayo Clinic, WebMD, and Planned Parenthood offer reliable information on vaginal health. Support groups, online forums, and local support groups can provide community and shared experiences. Professional help. Don't hesitate to reach out to a gynecologist or healthcare provider for personalized advice and treatment. Remember, understanding your body and what's normal for you is key to maintaining good vaginal health. If you're ever unsure or concerned about changes in your discharge, seeking medical advice is always a good step. Thank you for watching. If you found this video helpful, please give us a thumbs up. And subscribe to our channel for more health tips and information. Feel free to share this video with anyone who might benefit from it. And don't forget to comment below with any questions or topics you'd like us to cover in future videos. Take care. And see you next time. Hello everyone, and welcome back to our channel. Today, we're going to discuss an important topic that affects many women: maintaining vaginal health during menopause. As you may know, menopause can bring about a range of changes in your body, and it's essential to address these changes to ensure your comfort and well-being. Please subscribe to our channel, like this video, and leave a comment below. Menopause typically begins between the ages of 45 and 55 and is characterized by the end of menstrual cycles and a decrease in hormone levels, particularly estrogen. These hormonal changes can impact various aspects of vaginal health. So let's dive into some practical tips to help you maintain vaginal health during this time. First up, let's talk about diet. Eating a balanced diet is crucial for overall health, including vaginal health. Here are some key nutrients to focus on. Omega-3 fatty acids, found in fish like salmon, flax seeds, and walnuts. These can help reduce inflammation and support mucous membrane health. Phytoestrogens. These plant compounds present in foods like soy, flax seeds, and legumes can mimic estrogen in the body and help ease some menopausal symptoms. Hydration. Drink plenty of water throughout the day to stay hydrated and support vaginal moisture. Next, let's talk about hygiene. Maintaining good vaginal health also involves proper hygiene practices. Gentle cleansing. Use a mild, fragrance-free soap to clean the external vaginal area. Avoid douching or using harsh products, as these can disrupt the natural balance of bacteria and pH. Cotton underwear. Opt for cotton underwear instead of synthetic fabrics. Cotton allows your skin to breathe and helps prevent irritation. Exercise is another important aspect of maintaining vaginal health. Regular physical activity can help improve circulation. Enhanced blood flow can support vaginal health and alleviate dryness. Strengthen pelvic floor muscles. Kegel exercises can help strengthen the pelvic floor, which supports the bladder and can prevent urinary incontinence. Here's a quick Kegel exercise you can try. Identify your muscles. The muscles you use to stop the flow of urine are your pelvic floor muscles. Contract and hold. Tighten these muscles for 5 seconds, then relax for 5 seconds. Repeat, aim for 10 to 15 repetitions 3 times a day. When it comes to managing dryness, which is a common issue during menopause, consider using vaginal moisturizers. These can provide long-lasting moisture and relieve discomfort. Lubricants. Water-based or silicone-based lubricants can help make intercourse more comfortable. If you're experiencing significant dryness or discomfort, it's a good idea to consult your healthcare provider for personalized recommendations.
Lastly, don't forget about emotional well-being. Menopause can be a challenging time emotionally, and stress or anxiety can affect your overall health, including vaginal health. Consider stress management techniques. Activities like yoga, meditation, or deep breathing exercises can help manage stress. Support networks, connecting with friends, family, or support groups can provide comfort and valuable insights.
We're joined today by Dr. Emily Adams, a gynecologist with over 15 years of experience in women's health. Dr. Adams, thank you for being here.
Thank you for having me. It's great to be here to discuss such an important topic.
Dr. Adams, many women experience vaginal dryness and discomfort during menopause. Can you explain why these symptoms occur and what women can do about them?
Of course. As estrogen levels decrease during menopause, the vaginal tissues can become thinner, less elastic, and drier. This is because estrogen helps maintain the vaginal lining's thickness and moisture. To manage these symptoms, I often recommend estrogen replacement therapy (ERT). For some women, local estrogen treatments like vaginal creams or rings can help alleviate dryness and discomfort. Regular checkups. Regular gynecological exams are essential to monitor and address any changes in vaginal health.
That's very helpful information. Are there any specific lifestyle changes or habits that can support vaginal health during this transition?
Yes, absolutely. In addition to the tips we've already discussed, maintaining a healthy weight and avoiding smoking can also benefit vaginal health. Smoking can reduce blood flow to the vaginal area, worsening dryness and discomfort.
Thank you, Dr. Adams. It's great to hear these expert insights.
My pleasure.
To summarize, maintaining vaginal health during menopause involves a multifaceted approach. Nutrition. Focus on a balanced diet rich in omega-3 fatty acids, phytoestrogens, and adequate hydration. Hygiene. Use mild, fragrance-free products and wear breathable cotton underwear. Exercise. Engage in regular physical activity and perform Kegel exercises to strengthen pelvic floor muscles. Moisturizers and lubricants. Use appropriate products to manage dryness and consult with a healthcare provider if necessary. Emotional well-being. Practice stress management techniques and seek support when needed. Remember, menopause is a natural phase of life, and addressing these changes proactively can help you feel more comfortable and confident. If you have specific concerns or symptoms, don't hesitate to reach out to your healthcare provider for personalized advice.
Thank you for watching our video on maintaining vaginal health during menopause. We hope you found the information helpful and empowering. Remember, it's important to consult with your healthcare provider for personalized advice. Stay informed, stay healthy, and take care of yourself.